On behalf of the citizens of Huamachuco, we welcome our friends from Michigan State University to our city.
The purpose of Rotary is not only for local programs, but it's also for international programs. And in my case, because I was originally from Huamachuco, which is a city in Peru, we decided that we should start a club, a sister club in Huamachuco. Well, ever since we started the Rotary Club of Huamachuco, this is a very small club, but it's a very dynamic club, and it's perhaps one of the models for Rotary International, because this club is doing the construction of a clinic that will be servicing the people of Huamachuco, free of charges.
We had 22 students from Michigan State College of Osteopathic and human medicine schools. And then we had a couple other students from pharmacy and nursing, and then undergrad. And then we also had plenty of volunteers and about 12 physicians and a dentist and a few nurses.
We do it about once a year. We come here to help the community. We also do it in Guatemala.
We've seen 1,200 patients. It's really an area in need of medical services.
There's been times where we've seen 1,000 patients a day or so.
It's a good experience. It's a good experience for us as attendings, and it gives the medical students from MSU opportunities to see things that they wouldn't normally see in the clinical setting in Michigan, and to get in touch with a culture that's different from theirs, and to see people who are extremely disadvantaged compared to anything they'd see in the U.S.
Most of the funds came from the students themselves and the physicians themselves. That's really where the ability to do these missions comes from, is people's own pockets.
First time I've been in Huamachuco, first time I'm in the mission, and I love it, and I'm planning to do it like every single year if I can.
I came down here to Peru last year on this medical mission, and I was fortunate enough to get involved with the program, and I got down here doing this medical mission. My parents are doctors, and my mom's a dermatologist down here, and my dad's working the pharmacy. And just surrounded by great people doing a very cool, fun thing.
Met a lot of wonderful students and the staff here, so I can guarantee I'll be back, because it's at a point in my career now where my kids are, Vincent, my son, is here with me. He's a second-year student, and he's a student here. He's around the corner, and he speaks good Spanish and helped teach the Spanish course. He's the big reason that I came, is I wanted to do this with two generations. It's a once-in-a-lifetime kind of opportunity.
Well, it's been a little rough. A few of us have gotten sick, but other than that, I think it's been very rewarding. I think, many people have gotten a lot of hands-on experience, is what a lot of the people came up here to do, and give back a little bit, because it's very fulfilling work.
We found that we need to be reaching out more outside of our comfort zone, not only for us personally as people, but as young students, to learn how to interact with people. What are their circumstances, and how do we help them in the living conditions that they're in?
They have a lot of diseases that aren't being treated because they don't have money for medicine. They don't have an opportunity to see a doctor. So like high blood pressure, diabetes, going untreated.
If you are doing very well in this community, you're fortunate if you make about an average of an American $60 a month.
Yeah.
And that would be a good income where you could provide sometimes running water and a facility where you would have walls and maybe a roof over your head to protect you from the elements. Because they don't have an adequate clean water supply consistently like we do, the problems with parasitic infections, dysentery, malnutrition and infections are very, very high.
But it's just the lack of good nutrition and balanced meals that I think really makes them so susceptible to so many illnesses.
Our big issues are to help them with cleanliness, controlling the infection rates, and trying to help them in ways that we can. So, you know, we take for granted we can go to the bathroom and flush the toilet and wash our hands. Right. Well, when you don't have adequate running water and you can't afford soap, and really toilet paper is a phenomenal luxury, you can imagine all the problems with infections that they have.
A lot of parasites in the children, and that has to do with probably just hygiene and hand washing and food cleanliness. That seems to be a big problem here.
By the time they're probably 7 or 8, we'll have a lot of problems with scarring on the membranes of their ears because of all the infections they've had.
Unfortunately, a lot of the decay here is so far advanced that the teeth are not fixable, and we're looking at extractions, and with the little ones, it's a real challenge because most of them are not real cooperative. So it's a real challenge here.
The children, they're fun. They're like kids everywhere. They're having a good time. They're probably a little malnourished compared to if you look at the United States or Europe, some of the European countries. I think vitamins will help. Their fruits, fresh fruits and stuff, fresh vegetables, pretty kind of a little bit limited. But for the most part, they seem well loved and cared for.
If they're diabetic, they are on predominantly a carbohydrate diet. It's very difficult for them to get protein. And yesterday we were talking, and I gave one of the girls a protein packet because her mother is diabetic. And I asked her what she had for breakfast. And she had platanos and a biscuit that they make because that's what they have. And I said, well, you would have to try to have a little bit of protein with every meal. And she said, oh no, it's too expensive. It's 5 soles for 1 packet of fish. And 5 soles, American money, is only about $2, a little less than that. And that would be the amount of money that they would spend on food for the day, and sometimes, if you're very poor, for the week. So they have to rely on rice and bananas and the vegetables that they may make in their own garden.
Despite the poverty-induced health challenges faced by the people of Huamachuco, there is a downside to affluence.
Our hospital also goes to Guatemala on another medical mission, and we've been doing that several years, and we've watched through the years as the community that we've served has become more affluent, people have begun to smoke because they begin to have money and they can buy cigarettes with them.
The problems that Huamachuco faces in Peru are not unique to the town. There's quite a few countries in South America, the Indian countries especially, which have the same kind of problems. And the idea that we are working with Michigan State University is that because Huamachuco is a very willing and ready to start working in these kind of projects, Michigan State University is using as a place where we can design the prototypes that could be used for other towns in the Andean region of South America. I personally like to thank you all the organizations that have been able to contribute to this success of the mission. A person alone cannot accomplish all of these. It's just the people that work behind the scenes. And I'm grateful for Lansing the Wet Sunrise, who is the one that started this program, the Club of Huamachuco, which was very receptive to this idea. And then we included VASH International, C International, and now we have Michigan State University. I really am indebted to them. I'm very grateful for all the support that they have been doing